Hello, I'm Dr. Rick Shacket. I'm a board-certified proctologist. My practice consists of anal and rectal surgery, colonoscopy, and upper endoscopy. I've been in practice 30 years. I have offices in Phoenix, Scottsdale, and Chandler, Arizona, and I'm on the staff at Phoenix Baptist Hospital, where I serve on the clinical faculty of the residency program. What is the colon? The colon is the lowest part of the gastrointestinal tract. When we eat food, food goes down the esophagus into the stomach, into the small intestine, where it then passes itself into the colon. The food that enters the colon is liquefied, filled with digestive juices and enzymes. This extremely liquefied waste then moves up the right side of the colon, across the transverse colon, and down the descending colon. As it moves the food along, it absorbs water from the colon. The food becomes very hard. The waste product is a high-quality waste product and very solid by the time it reaches the rectum, where it's then passed into the toilet. What are hemorrhoids? Hemorrhoids are cushions of tissue and varicose veins that line the surface of the anus and rectum. There's internal hemorrhoids that lie under the mucous membrane of the rectum, and there's external hemorrhoids that lie under the skin of the anus. Internal hemorrhoids can be mild, from a slight swelling inside the rectum to a complete prolapse where the hemorrhoids fall completely outside the anus. External hemorrhoids can become thrombosed and swollen with lots of tiny blood clots underneath the tissue. Sometimes these blood clots cause bleeding, and definitely they cause pain. What is an anal fissure? An anal fissure, in simple terms, is a tear or crack in the tissues lining the anus and the rectum. Symptoms common to fissures are pain, bleeding, and itching. Typically, a fissure is very painful during bowel movement, as that is when the crack gets wider. Chronic fissures can occur due to lack of healing and scar tissue formation. Fissures lasting more than 3 weeks usually need laser vaporization of the base of the fissure. Fissures occur due to either hard bowel movements or forceful penetration of the anal canal from the outside. How do you get hemorrhoids? Hemorrhoids are caused by 2 main factors. The number 1 factor is genetics. If your mom or your dad had hemorrhoids, you're going to be more likely to get hemorrhoids too. The second most common cause of hemorrhoids is environmental. Environmental factors can be reading on the toilet, which causes an enlargement of the rectal blood vessels. Constipation from poor diet or lack of exercise causes more straining during a bowel movement. Excessive straining during a bowel movement during pregnancy is also a common cause of hemorrhoids. How are hemorrhoids treated? Hemorrhoids are treated with non-surgical and surgical options. Before patients come to their doctor, they frequently tried over-the-counter hemorrhoid creams and ointments first, and they just didn't work. Non-surgical options are my favorite, and I always try those first. Injection sclerotherapy is a matter of putting medicine inside the hemorrhoid that causes it to sclerose and shrink up. Rubber band ligation is a way to pinch off the blood supply to the hemorrhoid with a rubber band, causing the hemorrhoid to simply die and then fall off. Sometimes hemorrhoids require surgery. A laser can be used, a harmonic scalpel can be used. There's also a procedure called a stapled hemorrhoidopexy, in addition to traditional surgery.